Welcome to this edition of Chemical Kafka. The topic this evening is about the narcotic abuse and the use of naloxone for it. Now, the important thing to know about this is that we've got a journal from the Journal of Emergency Medical Services. It's very recent, it's from today. It's written by Dr. Neil Richmond. This is basically from the ambulance folks, the emergency medical services providers, and some of the first responders. And the gist that the articles about uh, some of the folks that are showing up on the scenes and administering naloxone to people that are believed to be overdosing from heroin primarily or other opiates, where people have stopped breathing and are essentially in the process of dying. So, um, Dr. Richmond talks about there's been recently a push to make this naloxone more universally accessible. And the reason is that there has been an increase in the use of intravenous opioids. And the reason for that is that the oral forms of these medications have been reduced uh, quite dramatically in many instances. So, what happens when the oral doses are more difficult to get? People that need that medicine or have become dependent upon it, they'll use what the next best thing, the injectable form. And because the injectable form might be heroin, sometimes it's difficult to know what's in that. If you're buying it illegally, obviously on the street, you may not know exactly what you're getting there. Sometimes you get too much, sometimes you get too little, you overdose, and that's where the naloxone comes into play. So, uh, the lack of the more reliable oral forms has led to an increase in the less reliable forms that are used intravenously, and it's caused quite a few of deadly overdoses. And basically, what he's pointing out here is that what we've done is we've identified a problem, and we're now just throwing a solution at it. Uh, the solution here being obviously naloxone. Now, he makes the point here that uh, when uh, at some level this makes a little bit of sense. Of course, when the house is on fire, you can't just sit inside and talk about why the house is on fire, how to prevent it from catching on fire in the future, and so forth. You need to put the fire out. You need to get out of the house immediately. If not, you're going to die. So you need to take care of the problem that's directly in front of you. However, after the crisis is over, you need to have a moment of calm reflection, and you need to try to understand exactly how did you find yourself in that situation. And that's something that unfortunately we just seem quite unwilling to do. And he's going to discuss part of the reason for that as the article goes on here on page 2. And basically, he starts off by saying that the, uh, the drug use involves a cycle. So you have somebody that is using drugs, perhaps even legally. Believe it or not, people do get charged with crimes for simply using medication that has been prescribed for them by a licensed physician. The Board of Pharmacy, some police officer thinks it's too much, or they really don't believe that person is in that much pain. The person can find themselves in front of a judge, in front of a jury, and being charged with a crime. That definitely does happen, unfortunately. And when it does, you have a situation where uh, whatever the person's initial problem was, they now have an additional problem, which is a problem with the criminal justice system. If that includes being incarcerated, you now have a person with a potentially a medical problem, then a drug problem, then a legal problem. Now they've been incarcerated. When they get out, as all of these folks are going to do eventually, they've lost their job. They've probably lost most, if not all, of their money, their worldly belongings, and their income, their healthcare benefits. Basically, they're starting over from zero. Okay. Now, has the system served that person? You've turned them into a criminal. Has the problem gone away? Has the situation been made any better? I would submit to you, and this doctor here is submitting, that this is not a way to improve that situation. In fact, he uses the term here, the problem is self-perpetuating. You end up, once you've been incarcerated or you have a felony record, at that point you have somebody that's going to have a number of problems after that they never should have had in the first place, because the system was overly aggressive. The state medical board, the state pharmacy board, the state nursing board, local law enforcement, DEA, whoever it is, whoever's got the blood on their hands, they have caused this problem. Perhaps well-meaning, perhaps in ignorance, not realizing that that's what they were doing, but that's what happened. And they talk here about this cycle. He goes on to say that basically it involves incarceration and release, which if the person didn't get drug treatment or sufficient treatment, they end up with a 911 call, trip to the emergency department, loss of job, loss of income, loss of home, loss of health care. And when you have people losing all that and they have the despair that follows, that leads to just simply more drug use. So that is the cycle. And what does he believe is part of the problem that leads to this? Well, he believes that it's from each individual participant in this system simply looking out for their own little part. And even when they try to cooperate or coordinate things, it simply doesn't work out. For example, the Ohio State Board of Pharmacy, they might identify a, quote, pill mill, a doctor that writes too many prescriptions, in their opinion, a pharmacy that dispenses too many prescriptions, in their opinion. They'll go in, they'll arrest the doctor, they've ruined his life. They'll arrest the pharmacist, they've ruined his life. The patients, they've got their records, they'll arrest the patients. These people are not offered an alternative. They're not treated as somebody that deserves respect. They're treated as a criminal. Why couldn't this information that's being used to prosecute them be used to help them? And as a result, you have what we see here. Because the tablets are very difficult to get, the people turn to heroin. So the medical boards, the pharmacy boards they're providing customers, they're increasing demands for heroin. As a result of that, you have an increase of use of heroin. That may not be the intent, but that certainly is the result. There's no denying it. This is exactly what's happening. And until each of these agencies realize that they themselves are actually making this problem worse, the problem is going to continue to get worse. The Ohio State Board of Pharmacy is going to continue to be responsible for driving people using pain medication into the arms of the heroin sellers. They can say, well, that's beyond our scope. We can't really solve that problem. We're just here to deal with the pharmacies. We really can't do anything about all of that. And that's fine. Keep saying that. And when we go to the funerals of these people who have passed on because they've gotten trapped in these cycles, you can tell that to the families. Okay? That's not solving this problem. It's making it worse. If you want to solve the problem, you've got to get off this law enforcement mindset and actually look at what you're doing to make it worse. You'll either do it or you won't. It's up to you, but there's no question as to what your role in this problem actually is.